Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan.
I'm Joe Steckler. Welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County, a show designed to provide you with information on how to develop your own aging and care plans. Our topic today is overall mouth care, and with me in the studio is Dr. Lee Sheldon. Dr. Sheldon is a periodontist. He also specializes in implants, and his company is called Solid Bite Dental Implants. Welcome, Dr. Sheldon.
Thank you, Joe. Good to be here.
It's great to have you. And folks, I want to tell you that Dr. Sheldon is our dentist that is providing all the information about dentistry, care of the mouth, implants, periodontal disease, senior care of the mouth. And a lot of it is in his book. I'll put it right here. It's called The Ultimate Mouth Manual. And it's not a commercial to sell your book, Lee, but it is a commercial for me to convince people as a lay person, just like I am. I try to study different ways I can help myself improve my own dental and medical care. And this manual that you've written does it in a simple way that we had a person on a submarine I was on one time, and they called him the Maul, M-A-U-L. Actually, it was me. One of my fellow officers dubbed me that, the Maul, because he felt it was so hard for me to understand the workings of that submarine. Well, I later found out that it wasn't me that was the Maul. I think it was him.
Yeah, probably.
But anyway, there are so many ways we're exposed to information in our life. We just simply don't take advantage of it. But today's show, I hope that our viewers will understand some of the very simplistic approaches and demonstrations that you're going to demonstrate today on overall mouth care. And my first question was, how neglected is care of the mouth today in today's world in which we live?
Well, you've got two sides of the coin. You've got one side that's been educated. Those people who are educated know they need to take care of their mouths in a number of different ways. One is total plaque control, which means that they have to remove plaque from their mouths once a day. And the other is making sure you're eating the right things that aren't going to cause tooth decay or cause your teeth to rot. So there's that side that knows that. And then there's the other side that either knows it and neglects it or never knew it in the first place. So let's address ourselves to that group right now.
The ones that
don't know about it. The ones that do know, you don't need to hear this from me, but stay with the program anyway. I'll have some good, interesting stuff. You'll get something too, I promise.
Okay.
So let's take a look. And the first thing is flossing teeth. Oh, I know you're bored. Oh, everybody tells me to floss my teeth, blah, 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 blah. Okay, let's talk about what floss is accomplishing. And I'll tell you what, I'm going to put the model right here. And if we can just focus in on this model, Seth, and just take a look at this. So here's a model of teeth. 28 teeth. No wisdom teeth here at all. Now, we can talk about what happens with tooth loss, but I just want to show you a tooth, a front tooth. So let's look. There's your front tooth right there. And let's assume that all you do is just brush that tooth and you don't floss. I'm going to take this tooth out now. It'll be one of the most painless extractions you've ever seen. So here's the tooth that's coming out. And I want to show you, there's the tooth. Okay, so there's the tooth from the front. Let me balance it pretty well. Okay, we got that? Okay. I want to turn that tooth over to the side. And look at how much of that tooth is being ignored by the brush. You see, the tooth is wider in the area between the teeth than it is on the front or the back of the teeth. There's no good way to get the tooth clean in that area unless you use floss or something or a brush that goes between the teeth. If you only use a brush and you just brush this portion of the tooth, that means 40% of that tooth is going to be brushed. What happens to the other 60%? And what we need to do is to make sure that plaque is removed once a day. Let's get away from this for a second. Let's talk about plaque, because there's a big confusion about plaque. There's this idea that, oh, I'm supposed to brush my teeth 3 times a day. You've heard that?
Yeah.
You've heard that? Brushing your teeth 3 times a day means that you're brushing your teeth and you're getting away food particles. Food particles do not cause disease. Yes, that's right. Food particles do not cause disease. The food particles provide food for the plaque, and it's the plaque that causes the disease. If we just remove the plaque once a day, which means that we put that brush directly on the tooth near the gum line, and we put the floss directly on the tooth below the gum line, understanding that when we go between the teeth, we've actually got 2 teeth to clean, the one on this side and the one on this side. And we just move that floss up and down, we're going to get that tooth clean. That's going to be very important for 2 things. Number one, it will help prevent tooth decay between the teeth. And secondly, it'll be very, very important and instrumental in preventing periodontal disease between the teeth.
Let me have your thing. When a person flosses, though, like, if we go down that tooth, are we trying to get under the lip of the other adjacent teeth or not?
You're actually trying to get below the gum line on each tooth. So if I had
Is that what causes the bleeding?
Yeah.
Okay.
That is what causes the bleeding. And the bleeding is called gingivitis. Inflammation of the gums, gingivitis.
Is that good or bad?
Gingivitis?
Yeah.
Not so good if you don't want bleeding gums. But the important part is periodontitis, which is the loss of bone support for the teeth. So that we want to make sure the tooth is clean to help prevent the periodontitis from occurring.
But having said all that, if a person does go...
Let me put the tooth back. This looks kind of funny.
Yeah, so you won't lose it. If a person does go for regular periodic, deep cleanings on their teeth,
Yes.
that tends to get the deep plaque that's underneath the gum.
It does, but there's 2 things we're talking about here. One is plaque. Plaque is the soft stuff. That's the stuff you're supposed to remove at home. When you're seeing the hygienist, well, let me go back for a second. If plaque is there for an extended period of time, or if plaque is well below the gum line because you have periodontal disease, the plaque itself becomes calcified and is stuck on the tooth like a barnacle would be stuck on the bottom of a boat. The reason you're seeing a hygienist for deep cleaning is to get that hard stuff off, that calcified stuff off. And usually, if you're a periodontal disease patient, if you've ever been diagnosed with periodontal disease, usually you're in our office every 3 months for cleanings.
Let me ask you a question. On one show we did, I told you, we talked about the fact that I was flossing my teeth one day, and I felt I'd broken part of my tooth off.
Yeah.
And actually, I called you, and you laughed, you said it was plaque.
I always laugh at you, though, Joe.
I know that.
Right.
I know that. But there's 2 schools of thought on floss. You've got the wax floss, and you've got the floss without the wax.
Yeah.
I never, in all the years that I floss my teeth, flush them too, floss my teeth. But does the unwaxed floss do a better job of removing plaque than the wax does?
No.
It doesn't?
No. But there's a reason to use unwaxed floss.
Why?
Because if a tooth is clean, you go up and down on the tooth with a wax floss, it's going to slip and slide around that tooth. But if a tooth is clean, once a tooth is clean, you go up and down with unwaxed floss. Go up and down, up and down, up and down. You'll hear a squeak. When you hear the squeak, you know the tooth is clean. So not only are you doing something from a tactile sense, but you're also getting an audio cue to tell you the tooth is clean, and now you can go to the next tooth.
Okay. Would it be safe to say at these 4 teeth on the bottom of your mouth, when you generally come out after having your teeth cleaned, you feel like you slide your tongue on the inside of those teeth.
Yep.
It feels like there's a hole, a line between each one of those teeth.
Right.
And by the time when I called you about my flossing, when I kept using that floss, I felt that line open up. What I was doing was breaking plaque away that the dentist would have generally done when they clean my teeth.
You're breaking calculus away.
Calculus away.
But this is a different type of calculus. The calculus that that accumulates here, that's an innocuous calculus. That's not causing any disease at all. When you buy a tartar control toothpaste, it's to help prevent that calculus from occurring. That calculus, unless it's been on there for months and years, and I've seen it be on for months and years, and it can cause damage. But as long as you're getting your teeth cleaned on a regular basis, while that calculus is a nuisance, and it makes it more difficult for you to clean your teeth because that calculus is there, that in itself isn't disease-causing.
Okay.
There's a different calculus that forms below the gum line in an area that you can't see. That's a calculus that forms around hard plaque, or around plaque, and that plaque combines with blood products, and that plaque and calcification all becomes a congealed, hard mass that's usually brown or black because you've got plaque plus blood plus calcium. That's important calculus to remove.
But when we talk about overall mouth care, that's a type of calculus or plaque that gets below the gums.
Yeah, that's right.
And that's what you can't see.
That's right.
And that's what you go, unless you're a very, very brave soul, you're not going to go down with that pick or that instrument you looks like a shepherd's staff and to pull that plaque out.
No, you're not. As a matter of fact, you can't. I'll tell you why. There have been studies done. I'll give you a study that was done. It was done about 40 years ago, and they took patients where they knew that the teeth were going to be extracted, and those patients went to see a hygienist. And the hygienist was asked to clean those teeth as well as she possibly can. The hygienist spent about 30 minutes on each tooth. On each tooth.
So I wonder how many teeth left.
Then they took the teeth out. Then they took the teeth out. The teeth were going to be extracted. So they wanted to see what a hygienist could do. Then they could take the teeth out because they could see how much calculus was removed. The hygienist was only able to predictably remove calculus 4 millimeters below the gum line. So if you go to your dentist or your periodontist, and the periodontist measures a 7 millimeter pocket, the hygienist cannot get down those 7 millimeters predictably and clean that root off. Neither could you if you bought that pick. Years ago, we bought something called an endoscope, a tiny camera that's only about the size of a head of a pin, which allows us to see below the gum line. Then we can effectively remove the calculus. But if you're just doing it by feel, which is the way that type of procedure, root planing, is ordinarily done, it's only effective to 4, maybe 5 millimeters.
When they did that scraping on that guy, did they give him lidocaine before?
Yeah.
Good.
Usually.
Okay.
Yeah. Well, I don't know. I wasn't there for that study.
Kidding, but
I think so. We do. When you're cleaning below the gum line, understand, you're only cleaning well below the gum line because you have a disease. If you have a disease there, you have ulcerated tissue. That hurts. And so, yes, you do have to get the area clean just so you can, or numb, just so you can effectively clean it. Once it's cleaned, that irritation should go away, and then you can take that probe and comfortably probe around the patient's mouth and you can do just fine.
Since the focus of our show is focus on seniors, the first question I get, and I had an article in Florida Today recently about it, was old. And a lady came up that read the article and she said, Joe, I don't like to be called old. She says, I don't mind if they call me older. Everybody's got their own idea.
That's right.
But at some point, our teeth become older teeth.
Yes, they do.
And we're more prone to cracked teeth. We're more prone to gum disease. We're more prone to not taking care of our teeth.
Yep.
So how does one develop a better or a plan for overall care of the mouth as you get to be 50, 55, 60, 65, 70, 75, 80, on up?
Well, number one, you have to work closely with your dentist because the dentist will discover things that you wouldn't be able to discover on your own. For example, let's assume that you have big cavities and you've had lots of fillings done. Well, over the years, those fillings might become brittle or the teeth themselves might become brittle. And so you may be grinding your teeth. So you may have lived with these large fillings for years and years and years, continually grinding and grinding and grinding and grinding your teeth. As you get older, those teeth will tend to break. And so if there's evidence of tooth wear, and a lot of us have tooth wear, if you just take a look at your lower teeth, just look at your lower front teeth. After you're done the show, look at your lower front teeth. If you don't see white right here, at the tops of your teeth, if you see this kind of brown stain there, that means you've ground away at least 3 millimeters of your tooth structure. I know, you say, I've never ground my teeth. You know what? When we grind our teeth, we only grind our teeth a little bit at a time. It goes like this. And then a little bit more. And a little bit more. And it lasts for about 5 seconds, and then there's an interval. It isn't like a baby grinding his or her teeth, where you hear this grinding sound. Just a little bit, you keep on doing this, you're going to wear away the tooth. If the tooth is worn, your teeth become sensitive, they become more prone to decay, and they become more prone to fracture. One of the things we do for patients like that is we use something like this called a night guard. This is a little plastic guard that fits over the teeth. Sometimes we make it over the top teeth, sometimes over the bottom teeth, depending upon who the person is. And the night guard provides a nice smooth plastic surface. So that rather than grinding against the teeth themselves, you're grinding away against a piece of plastic. Far better for the teeth. Far better if you allow the night guard to wear away and replace that night guard every 2 or 3 years than to break a tooth and have to put a crown on that tooth.
I have a couple questions. Let's have that back.
Sure.
Okay. I have a night guard, but this night guard is very thin. Is this a real one?
That's a real night guard.
Okay. I was worried that thing might come off during the night and I might swallow it.
Yeah.
Does that ever happen?
No. Well, has it ever happened? Anything could happen.
Oh, anything could happen.
But a night guard should be fitted in such a way that it snaps over the teeth.
Well, mine was.
It shouldn't be loose.
They made a denture,
Yeah.
and then they fit the thing, but mine goes all the way to almost all the way to my gum line.
Is it soft or hard? Is it flexible or is it hard
Yeah,
like
it's
this?
flexible.
Okay. A flexible night guard is a simple night guard. But a flexible night guard, I don't do those. Or I very seldom do this. This is hard as a rock. This is real acrylic. Why? If you put a flexible night guard in your mouth, Joe, a flexible night guard.
Yeah.
Imagine chewing bubble gum 24 hours a day. That's what you're doing with a flexible night guard. You can't control your grinding forces, but if you have something that is that soft, you're going to tend to chew on it. Second thing is, if we control this, notice there's a little bit of a ramp right here. Now, you may not be able to see it on camera.
I can see it.
Okay, there's a ramp right there. If we only have the front teeth in contact for many people, rather than the entire bite surface, if you only have your front teeth in contact, there's going to be fewer forces on your muscles. If you were just to put something between your teeth, go ahead, put something between your teeth. You have a pencil, you have a pen, put something between your teeth. Go like this. And I want you to do, in fact, let's do this first. Squeeze your teeth together. Just clench them. You feel those muscles? They're these big muscles. One is called the temporalis muscle. The other one is the masseter muscle. You'll feel it come out. Now watch what happens if you just put something between your teeth. Just between your front teeth. Now try to squeeze as hard as you can, and what you'll notice is those muscles don't come out. With a hard night guard, I can direct the forces wherever I want it to be. And if I'm trying to minimize your muscular force, I can do that with a hard night guard. Never could do that with a soft.
What if I take my soft guard, when I go home,
Yep.
if I take my soft night guard and put it in, squeeze on the thing, and these things come out, is it okay?
No. You would rather not have...
I mean, and they don't come out.
When they don't come out, it's okay.
But I'll check it.
But I want you to, go ahead and compare it when you go home. And on our next series of Helping Seniors of Brevard County, Focus on Seniors program, we're going to find out what Joe found out. And he's going to bring in his soft night guard.
Okay, I'm going to do that. That's
all
what
right.
I'm doing.
Good.
See, you always learn something.
Thanks. We've been together for a long time. Yeah,
did you discuss what we just talked about in your book?
No, but that'll be a new chapter in the Ultimate Mouth Manual Part 2.
Okay. Folks, there are a lot of good information things in there. In fact, one, it's not, I don't have it in my script.
Oh, wait a minute. Yes, it is in there. It is in there. Yes, it is.
It is in this.
Yes, it is.
Okay, but one of the things you did talk about, and we've talked about it on a couple of shows, I think it's important because there are so many people being treated for cancer now.
Yeah.
Of all types, men and women. A point you make in that book is that before you have a cancer treatment, And I'm assuming you're talking about chemotherapy and radiation?
Particularly radiation, but chemotherapy
radiation.
too. Yeah.
You say, see your dentist.
That's right.
It's a good tip for people. Why should a person is going to go for a radiation and part of their cancer treatment, why should they see their dentist?
If you're having radiation therapy to the head and the neck, if you have a tumor in this area here, while the radiation therapists are much better at directing and targeting the radiation to get to the right organ, it will go, sometimes through salivary glands. If it goes to the salivary glands, it will kill the salivary glands and kill the saliva that's being produced. If that's the case, the mouth will become dry. If the mouth becomes dry, it becomes very acidic. And so what we want to do is to make sure that you have some caries, or caries is the name of the disease that causes tooth decay. Caries prevention. There are rinses that you can do. There are guards that you can do, and there are rinses that you can do. I probably said rinses twice. That you can use to help prevent yourself from getting tooth decay. In addition,
they don't spell like Kerry, like the guy that's doing from TYG Media that's doing our TV show.
The different ones.
Different ones.
Okay. Caries.
Caries, not
Yes.
Kerrys.
Right.
Okay, all right. So it's different. If a person loses the ability to laugh and have fun, you have more problems than overall mouth care.
I do, and I want to show you a cosmetic case. So let's take a look at this gentleman before. And notice he has the big mustache. And notice what happens when he smiles. He came to me because he wanted to be able to chew better. He didn't even care about how it looks. Well, now take a look at how it looks. No dental implants. Just good crown and bridge care. Not only is he able to chew, but you should notice he shaved off his mustache.
What did you said you didn't do an implant.
No.
What did you do?
We did bridge work on his natural teeth. Use his natural teeth as the supports for the bridge work.
When you say bridge work on natural teeth, what do you mean by that?
That essentially means that you're taking each individual tooth, and notice those teeth were misshapen. You reshape them, and then you make a prosthesis, you make teeth that fit over his existing teeth and are cemented permanently in place.
Do you have to grind the under teeth down?
You do have to grind the teeth down in order to be able to do that.
So it's actually a form of a crown.
It is a form of a crown, but it's a big crown. It covers the entire arch rather than just a single tooth. But exactly right.
You could take, well, my teeth are in pretty good shape, but if they were not in good shape, you could grind from here all the way around to here and make a bridge that fit over that?
Yes. And if the supports are good, we prefer not to do that, by the way. Dental implants help prevent us from grinding our teeth down. But if we don't like the shape of the teeth, and we're trying to improve the cosmetics anyway, we are going to grind down those teeth in order to be able to make them look good. And we can give a person with the beautiful porcelains that we have available now, we can change a person's entire look. In his case, change his entire life.
Well, I could, but I'm not going to do it. I could pull my gum back, and my dentist did. We get into this thing, but it's interesting.
I want to see it. No,
you're actually, can you see it? Can you see that?
Yeah, I can. You've got a bridge there.
Yeah, I got two false. I had two crowns.
Right. Yeah.
And I had a fractured tooth.
Yeah.
And they pulled a fractured tooth, and my dentist. This wasn't you. You're doing the implants over here.
That's right. You have no teeth back there at all.
Yeah, because I had no teeth.
That's right.
But here they could take two old crowns I had out and made a bridge that fit on the two old crowns that anchored this one tooth in here.
That's right.
And he did that. But
so imagine doing that, and this gentleman had it done on the same thing done on all of his teeth.
All of his teeth.
Yeah.
And actually, it feels just like my regular teeth.
Yeah.
The way they put this thing in. But what I was trying to get was the color. The old days they did the used gold a lot in bridges.
Yes.
But this has got some kind of a gold alloy in it to strengthen it?
Correct. There's a gold alloy, and then porcelain is baked on top of that alloy so nobody can see it. So you have a foundation of metal, and then you have porcelain baked on that.
Okay, because you were doing that. One of your assistants was checking the colors of my teeth doing that.
Well, when we're taking a shade, there are numerous shades the teeth are. For example, that individual said, while we're going to do this, let's make my teeth a lot whiter. And so we were working with his entire dentition so we could make the teeth whatever color we want. But for things to look natural when you smile, we don't want bright white teeth here and slightly yellow teeth over here. So we have a shade guide which allows us to match your existing shade.
But with all the improved technology we have, we can do a much better job of doing all the matching and making it available or capable. A person can leave a dentist's office and feel that their teeth look more like their real teeth.
And that's the goal. And we can do that. With the porcelains that we have now, with the ways in which we can layer different colors of porcelains to have gradual gradations of shade, we're no longer in that chiclet look. We can actually make a tooth look like a tooth. And there are dentists and laboratories that specialize in making teeth look exactly like teeth. All of the laboratories are good, but there is that high-end laboratory that's just going to spend a little bit more time to do it better.
I want to take a look. We've talked about a little bit about implants and everything. In the last couple of minutes I'd like for you to maybe tell our viewers what you, as a periodontist and a guy that's taking care of all kinds of mouth, what do you feel are some of the greatest contributors, some of the things that people could do easily to take better care of their overall mouth care?
Well, there's a couple of things. Number one, we already talked about eating well, and we did talk about brushing and flossing, and that's very, very important. I think the biggest thing that we're concerned about right now is neglect. Is that we say, all right, I've lived long enough, I'll eat whatever I want, I'm only going to live a few more years. It's that feeling of, all right, I'm on the downside. You're never on the downside. Your mouth is a reflection of the health of the rest of your body. And frankly, if you do everything you can for the rest of your body, I'm talking about eating well and making sure that you're not putting in sugars, not a lot of fats, and certainly, my big thing right now is making sure that we stay away from wheat as much as we possibly can, or at least for those people who may be allergic to it, and there are a lot more people around than we think are right now. That you keep those sugar spikes down. By the way, white causes a sugar spike that may be higher than sugar causing a blood glucose spike. So you take care of yourself. Not only are you going to live longer, perhaps, but your quality of life is going to be that much better.
And it's important, and you have driven this point with me, and so has my own dentist, Dr. Mason, that the mouth is a great transmitter of disease.
Yes, it is.
And the better we take care of it, the cleaner we keep it. And if we have another medical condition, the better chance we have of minimizing the effect of that other medical condition on the overall body, because the mouth and the jaw muscles are great conductors for disease for our body.
That's right.
See,
couldn't have said it better.
I've learned all that from you.
Thanks, Joe.
Thank you, Dr. Sheldon, for being on the show. Thank you for watching today's episode of Focus on Seniors. If you have questions or comments, please call radio station WMEL 1300 AM at 321-631-1300. For more information on senior care and resources, visit our website, helpingseniorsofbrevard.com. And I want to thank you viewers for watching, and I hope that you've learned something about overall mouth care. Thank you, Dr. Sheldon.
Thank you, Joe.
You're quite welcome.